Welcome to your guide to the thigh lift procedure. Take a few minutes to familiarize yourself with the procedure and what you can do to help improve your results. Remember, this presentation does not take the place of your consultation, and you should make sure to jot down any questions you may want to ask us later. A thigh lift or thigh-plasty is a popular procedure for patients who have lost skin elasticity around the thigh and hip areas. Often the effects of age or massive weight loss can leave the upper portion of the legs flabby, dimpled, and saggy. A thigh lift can help to reduce the excess skin and return the legs to a smoother, more youthful contour. Thigh-plasty is often combined with other procedures, such as an abdominoplasty, belt lipectomy, or buttock lift, in order to create an aesthetic balance throughout the lower body and trunk. Procedure: how will your thigh lift be performed? The procedure can be tailored to meet a variety of needs. The two most common techniques are the inner or medial thigh lift and outer or lateral thigh lift. The inner thigh is often difficult to reshape with diet and exercise, as the skin is thin and relatively inelastic. An inner thigh lift addresses excess saggy skin and fat on the inner slope of the thigh. To accomplish this, an incision is made in the lowest part of the crease between the groin and each thigh. For massive weight loss patients, a vertical incision along the inner thigh may be used as well to achieve additional correction. Skin and fat is removed and the skin of the inner thigh is pulled tight and sutured closed. Finally, dressings are applied to promote healing. Excess skin and fat throughout the outer portion of the thighs and buttocks can be addressed with an outer thigh lift. This procedure uses an incision along the top of the pelvic bone on each side. Depending on the amount of correction desired, each incision may extend horizontally as far as the center of your body. Excess skin and fat is then pulled up towards the incision and removed. Finally, the incision is sutured closed and bandages are applied to promote healing. Preparation. It is important to discuss your desires and listen closely during the consultation so that you can set realistic expectations. A great result can only be achieved when there is good communication between us. Together, we will select the technique that will provide the best result for you. When you meet with our patient coordinator, we will discuss fees and costs. Some suggestions to help you prepare for surgery. Your safety matters to us. You should be very open. Provide all of your medical history, drug allergies, list any previous surgeries, medications, diet pills, vitamins, and herbs you are taking, even if you don't think they're important. Also, don't be afraid to be frank with us about your lifestyle, smoking, the strenuousness of the work you perform, your exercise habits, and the importance of getting back to work. Here are some tips that may help you reduce scarring, shorten your recovery time, and decrease your chances of complications. Discontinue using aspirin, ibuprofen, naproxen, St. John's wort, and vitamin E for 1 week before and a few days after your procedure. These act as blood thinners and could cause problems with blood clotting. Stop smoking and drinking alcohol in excess well in advance of your thigh lift and for 1 week after surgery. Drink lots of water in the days leading up to your thigh lift. Hydration will help you recover more quickly. To make your recovery easier and more comfortable, be sure to arrange for someone to take you home and take care of you for at least the first day. Fill your prescriptions and place them within easy reach of where you will be resting. Place plenty of pillows nearby for comfort. Have loose-fitting clothing ready to wear. Have a second set of compression garments, as this will help you feel fresher. Use ice packs to help reduce swelling. Avoid salt and drink pineapple juice, as this may help reduce swelling. Recovery. You should expect some pain, swelling, and bruising following your thigh lift. Discomfort is usually moderate and will be managed with medication. Severe pain that is not relieved by medication is not normal, and we would want to know about it immediately. Bruising usually lasts a few weeks, but swelling may take several months to subside. The recovery process is different for everyone, and if your thigh lift has been combined with other procedures, it may take some additional time for the bruising and swelling to subside. It is important to carefully begin walking the day after surgery, even if you still have some discomfort. Refrain from stressing or stretching your healing skin, especially where it has been sutured closed. Sitting or squatting is not recommended, and any surgical dressings should be changed as needed. As your body heals, it is important to wear compression garments in order to ensure the best possible new contour for your skin. Stitches will come out or be absorbed on their own between 10 to 14 days. You should plan on being out of work and away from your usual activities for at least 2 weeks. During this period, you should be able to return to light activities. Avoid any high-impact activities for about 1 month. In particular, you should avoid the sustained exertion of jogging, bouncing, and leg-stretching activities for up to 6 weeks. After this period, you may gradually return to activities such as lifting, exercise, and sex. These precautions will help you avoid stress to the treated areas and allow time for your tissues to heal and recovery. While there will be permanent scars, they should be fairly well hidden. After about a year, your scars will usually flatten and become less noticeable. Although you should see immediate improvement in your contour, the appearance of your thighs should improve over a period of several months. What are the risks of thigh lift surgery? This information is not intended to frighten you, but to help you make an informed decision. No question or concern is silly or insignificant. We will be happy to discuss the full range of potential complications and answer any questions you might have regarding this procedure. Thankfully, complications are infrequent in thigh lift surgeries, and many thousands of procedures are successfully performed each year, but they can occur. Complications can include, and are not limited to, hematoma, infection, reaction to anesthesia, nerve damage, asymmetry, fluid accumulation, unfavorable scarring, and blood clots. As with all medical procedures, be sure to choose your surgeon wisely. It is important to choose an experienced surgeon you can trust and develop a good rapport with so you can openly discuss your concerns and particular needs throughout the process of consultation, surgery, and aftercare. Should you decide to move forward with your thigh-plasty, a surgery date will be scheduled. Prior to surgery, you will be given complete preparation and recovery instructions. Remember to keep your follow-up visits, as we are here to help make this a wonderful experience for you. Feel free to review any part of this presentation you like, and be sure to take a look at our before and after gallery to get a better idea of the results you may achieve.